Now passing on to my colleague Adrian Smith, who will have a discussion with our partners from Element Blue on topics like healthcare, how the healthcare industry managed with the pandemic. So I'm looking forward to the discussion that I'm sure it will be very interesting.
Element Blue, transforming the healthcare customer experience through innovative portals and hyper-automation platforms. Revenue cycle automation, patient portals, telehealth solutions. Element Blue Solutions, healthcare innovation delivered.
Hello, Raluca, and hello to everyone. One of the disadvantages of these live events is that you never know what challenges it might bring. So while Adrian gets prepared for the next interview, it is my great pleasure to be here with Joe Nieto from Element Blue, especially because Element Blue was one of our first partners in the US. And actually the first partner to sign a deal in the healthcare area for Druid. So, hi, Joe.
Hi, everybody. What a pleasure and an honor to be here with the Druid team. There is so much going on at Druid. It is just an exciting time to be here.
Thank you for that. So, what can you tell us about Element Blue and especially your focus on healthcare? Because I know you have a lot of customers from the healthcare area and you are quite experienced in that.
Sure, absolutely. So Element Blue has been around, about 20 years. We're based here mostly in the Houston area, Houston, Texas, and here in the US, because of the medical center and because of the energy. So in the 20 years, we've been working in a lot of different industries here in the US. And in fact, we have offices around the world that are able to kind of service our customers in those locations. But in the past 5 or 6 years, we've been really pivoting heavily towards healthcare and learning about what we can apply, what we've learned from other industries to kind of help reform and bring changes to the healthcare.
Mm-hmm. And when we talk about healthcare, we cannot not think about COVID and the period that just passed. How did this year go for Element Blue and the healthcare industry?
Sure, absolutely. So the one thing that COVID really uncovered quite a bit was how unprepared the healthcare industry was going to be. And that created a lot of opportunity for us. What we saw happening with the customers is that we're struggling with new processes and new training requirements, a huge amount of paperwork to get everything from vaccine tracking to testing, going back up into the government organizations so that decisions could be made, quite frankly. And there was a backlog that needed to be addressed. There was a training issues, as I mentioned earlier. And what we saw was an excellent opportunity to bring in automation from UIPath, which is one of the Druid partners. So we were able to implement automation from UiPath to help facilitate gathering information of test results and getting them sent on to the government agencies. We also implemented chatbots to help with that, to disperse a lot of the information. If you can imagine, here we are in the middle of a pandemic and there's a lot of information that needs to be sent out. Call centers are being overwhelmed, hospital phones just ringing off the phone. So everybody's worried, everybody's scared. What are we going to do? Where do I go for treatment? What are the symptoms? And so we have the capability using Druid chatbots to ingest information from people, gather information, gather the symptoms, and also play back information saying, well, these are the symptoms that are coming down. Here's where you can get vaccinated. Here's some of the locations you can go to. So automation really helped us through the COVID.
Yeah, so I guess so. And I know that you are a partner with UiPath, one of their most important partners in the US, especially in the healthcare area. You've mentioned UiPath. What about other mission critical application that you would see as benefiting from integration with Druid platform?
So yes, absolutely. So what we're seeing now, we work with the different EMR systems such as Epic and Cerner and those EMR systems, and we have a layer. We have a UiPath layer that's essentially doing a lot of the automations for us. And what we're bringing in now is the Druid, because we can automate the processes, which helps quite a bit. It's offloading everything that you hear about automation, processing benefits are certainly true. We're seeing huge amounts of claims being processed. We see huge amounts of cycle time being cut out to where the processes that used to take 15 to 20 minutes with a human doing it, our automations can cut that way down to 30 seconds to a minute. And that's just transaction based. Where Druid comes into play is that now, because we've broken those processes down into what we call tasks, we can have Druid sit on the front end and kind of interact with patients, interact with the public, and have some of those tasks accomplished without any humans involved. So we have a use case, just a basic use case where somebody has to call in, and let's say all they need is an insurance card. So normally they would call the 800 number, wait in the queue, wait for somebody to pick up the phone, and then you've got somebody on the phone. You've got to validate who is on the other line, pick up their pull in all their information, and so now the clock's been running, and it could be easily 20 to 30 minutes before something gets done. But with a chatbot, the patients can connect up to the website, start interacting with the chatbot. We'll find out who they are. We'll find out what they need to do. And if it's just maybe a reprint of a statement, or I need a copy of my insurance card mailed out to me, they're in and out very quickly. And it's open 24/7, 365, as opposed to calling a call center or a hospital where most likely they're only open between hours 8 and 5.
Yeah, so basically you've answered my next question that I had in mind. So how did the patients actually perceive the conversational assistance packed with AI? How was
Sure.
their feeling about it? Yeah.
They really love it. We've gotten really positive feedback from our patients. At first, we weren't sure where it was going to go, but I think there's been a fundamental shift over the past few years where the patients in their own lives are used to going to Amazon and having interaction with the websites to get tasks done. Even simple tasks like going to um, your television provider and ordering service. Everybody's used to doing it through the cell phone, or they're used to going to a website or a chat bot. Those kind of tasks are now becoming more widely available in the healthcare. Um, my biggest client is a children's hospital. So you can imagine these are parents primarily that have children that it's just not convenient for them to do it during the day. So they get the children to bed, and in the middle of the night, they go, well, I need to find out, or I need to schedule an appointment, or I need more information about the test results, or whatever. Now they don't have to take off time from work. They don't have to remember, let me get up early in the morning and try to get into the call center and talk to somebody at the hospital that can help me. They have the chatbot that's available. It's available on their mobile. It's available on their laptop, on their iPad. They can go there. They can get help. And even if they can't get the task completed all the way through, they can still submit a request. And there's occasions where that comes up. They may have unique circumstances where the chatbot can't help them all the way, but it can get about 80% of what they need. In the last 20%, we notify a care team member and they follow up with them.
Yeah, and then I know how important it is to have someone answering back, especially when it's kids related, children related.
Yes.
So yeah, that's quite quite
Yeah.
something.
So it brings up another topic, and it has to do with the competition in the healthcare. So we have the large hospitals that everybody knows, and then they're getting competition from the smaller organizations that we call them just kind of pop-ups or ER systems, ER centers that they can go, like urgent care centers. So where a patient would normally go to the hospital, they may go to an urgent center and get some care. So that's taking business away from the hospitals. So the hospitals are trying to figure out, how can I get more efficient? One of the numbers that we look at is for a telemedicine appointment today. A telemedicine appointment runs about $200 for a hospital to do a telemedicine appointment. We're trying to get that cost down significantly down, and we're making headways. But when you look at the competition, you have some organizations that all they do is telemed. They have no overhead, and so their cost is between $50 and $75 to do the same appointment. So we're trying to bring that down a little bit, but there's actual things that the hospital can do that a telemed system will do. And so through the use of automations, through the use of chatbots, we're trying to get that gap a little bit closer.
Yeah, totally. So I would ask you also product related, because we had a lot of conversation and we have benefit from a lot of feedback from Element Blue regarding the product itself and the Druid platform and the functionalities. And so we learned some lessons from the projects that we have, and especially from the feedback that we've got from you as a UiPath partner and also a specialist in this area. So what can you tell us about, I know you have seen a preview of the new Druid platform.
Mm-hmm.
What can you tell us about this? How easy it was for Element Blue to start with Druid and then reach this phase with the new
Yes.
functionalities and
There's some really good functionality that we're looking for. We're excited about conversations being presented in the graphical form, for example. That's a big win for us because we're a technology company, but we have to communicate with physicians and physicians organizations. And so when we start talking about cognitive abilities and natural language understanding, it's like them talking to me about cardiac and pulmonary tests. I have no idea, right? But we have to find a common ground. And so being visually to present how a conversation flow is done makes us connect at a level that's a lot easier for them to understand. And so that's a direct benefit from using Druid that's going to help. The other things that we do is that we're working to enable the departments within the hospital. So our goal is to build a framework so that the hospital has their chatbots laid out for functionality, and we'll take a first or second iteration to get their functionality up, and they're happy with it. But there's always changes that come up. Somewhere along the line, there'll be oh, I need the chatbot to do this, or I need to change the way this question is asked. So we're enabling the department to do their own changes, right? And so the ability for Druid to recognize roles and management roles, we have a specific authoring role set up just for the department that we train, you know, and it works for them because they can make their changes as quickly as they need to. And it works for us because we don't have to assign a developer to make the changes, a small change. It might take us, 10 minutes, but then you kind of look at it, I've got a list of other automations and other chatbots that we're building that need to be worked on.
I
So
know.
we're enabling the business teams.
Yes, this was the entire idea behind the no-code read platform, so that the business owners of the chatbots can do changes and train their chatbots and so on. But on the other hand, there is the connector to other systems and the connector to UiPath and
Yes.
like stuff that you are like proficient in doing.
Yeah.
What
Yeah,
can
it's
you tell
big.
us? Yeah.
I was gonna say the connectors are huge for us, because the way that um, we look at the industry and where they need to go, where automations are going. We're really passionate about integrating UiPath and Druid to work together because we see Druid as a window into not only the patient, because we now have the ability to connect 2 points. You have the patient that they may be at home, they may be in the office, they may be on the phone, and then we have the hospital, and so it's bidirectional. We can exchange information one way or the other. But even more than that, um, now instead of just having a conversation, we can automate a lot of the tasks that won't require a human. And that's the lift from UiPath that's going to come into play. The whole ability to say, I want to schedule an appointment. From a human perspective, I just go, well, I just want to schedule an appointment. But on the back end, you could be interacting with 5 or 6 different systems. You could go to the EMR to pull up the patient's records. You could go to the appointment system. You could go to the marketing system. You could go to the CRM system. You could go to the finance and the insurance portals. All these systems uh, work together or come together to do one task, which is schedule an appointment. So we're trying to hide that complexity using UiPath, which helps quite a bit from the human perspective because they can focus more time with the patient and with the customer instead of going, well, okay, I've got 3 or 4 monitors up. Now I've got to go to this screen to do that and this screen to do that, because then you have the training issue, and you can't take a staff member or a care team member and just put them over here, because now you have to do all kinds of training on that system. Then you have security issues because maybe they don't have rights to do what they need to do, and so we're trying to remove a lot of that complexity.
So what's next for Element Blue?
All right. So for Element Blue, we're going to continue to work with hospitals and healthcare organizations to kind of continue to push the envelope. There's a lot of functionality, there's a lot of technology that is available to them that they may not even know. And so we try to change the conversation about from a technology focus to um, a what if scenario, and get them to thinking at the higher level, at the idea level. I want to hear ideas. There's needs out there. I like to talk about the need for the most efficient use of a physician's time. And some of that time, a lot of the time is really spent looking at medical records, getting updated on their patients. So it's not always an efficient time to sit there and have to break time from seeing other patients while using a chatbot, for example, a voice-enabled chatbot that's coming up soon, that will allow them to, say, have an earpiece and have the chatbot drive the conversation with the physician. The physician can sit there and say, I like an update on my patient list for tomorrow. The chatbot understands what they're trying to do. It could pull the medical records and go, tomorrow you have patient A. Patient A, there's a synopsis. It can read back to them. And the physician can say, oh, maybe some test results came up. Maybe their white blood count is up. They have an infection. So you can order a panel of tests, and the chatbot will understand contextually. I know who the patient is. I know who the physician is. I know the medical records. And that's enough for a UiPath process bot to go out and order a panel of tests, update the insurance record, update the physician's notes. And it's all from an utterance to go, yeah, I like to order a test. So our mission really is to keep pushing the envelope with our customers.
So I think it's every employee's dream to have this kind of personal assistant that would help him out with the daily task. And especially as a doctor, you would need this kind of assistant to help you with the chores, actually.
Absolutely.
So thank you so much, Joe, for being
Thank
our
you.
partner, for your constant feedback, good feedback for us.
Yes.
And we are really glad to have you in this journey with us. And
Wonderful. Yes, we're
the
really excited. We're really excited about where Druid is going. We're excited about the vision. We're excited about all the functionality coming out of this next release. We can't wait to really start digging into it.
thank you so much.